Acne, pimples, and acne vulgaris are chronic conditions that start with the clogging of sebaceous ducts, follicular hyperkeratosis, against the backdrop of oily seborrhea in adolescence, when blackheads and pimples appear on the face in the area of the nose, cheeks, and chin. Then they become more numerous and appear in greater numbers. All of this can significantly worsen the quality of life for a teenager, as the face is often affected. How can you help such a person without using antibiotics and hormonal ointments? Acne appears due to the disruption of the functioning and inflammation of the skin's sebaceous glands, mainly on the face and upper body. In mild cases, only comedones are noticeable, which look like small white nodules, sometimes with a black dot in the middle. The result of inflammation of the comedone is the well-known pimple, pustule. In severe cases, acne can lead to the formation of scars, and teenage acne scars can lead to psychosocial problems that cannot be underestimated, especially in adolescence. The disease is exacerbated by excessive use of cosmetics such as powders, blushes, and foundation creams, as well as irrational use of medications. The skin is one of the largest organs in the human body. It connects the internal and external environments, and its integral parts are hair follicles and sebaceous glands. There are many reasons for the appearance of pimples, including increased production of sebum, seborrhea, clogging of the hair sebaceous apparatus with a keratin plug, colonization of the initial duct with bacteria, Propionibacterium acnes, inflammatory and immune reactions. Seborrhea is particularly intense during puberty, menopause, hormonal imbalances, and metabolic disorders. Factors that affect the regulation of sebum production. Deficiency of vitamin C, which strengthens blood vessels, enhances immunity, and regulates secretory activity. Infection with the yeast fungus Pityrosporum ovale, infection with bacteria, Propionibacterium acnes, granulosum, avidum. Inflammatory skin lesions increase the number of bacteria by 10 times. Bacteria do not participate in the formation of comedones, but their number decreases with antibacterial treatment. In many cases, trigger factors arise as a result of disruptions in human nutrition. Humans appeared about 250,000 years ago. During this time, the human genome has not significantly changed, but agriculture, industrialization, and everything around us has changed significantly. It has been suggested that this maladaptation may be the cause of civilization diseases, including acne. This can be confirmed by populations of people who follow a Paleolithic diet. In some islands of Papua New Guinea, people never have acne on their skin. Their diet consists mainly of carbohydrates, about 70%, in the form of vegetables and fruits with a low glycemic index. Dishes containing flour, salt, and sugar occupy a small part of the overall diet. Inuit, the indigenous people of northern Canada, have not been diagnosed with acne. When Western habits were introduced, processed foods, milk, sodium, beef, acne appeared. But this theory suggests that by changing the diet correctly, people can help with this problem. Doctors often say that the main treatment is antibiotics, local treatment, forgetting about the possibilities of non-pharmacological interventions. A proper diet should be based on foods with a low glycemic index, high intake of fruits and vegetables, high levels of zinc and provitamin A, beta-carotene, limiting consumption of chocolate and other sweets, spicy foods, and milk. The diet of people suffering from acne should be properly balanced, providing all necessary nutrients, minerals, and vitamins, and excluding foods that have been proven to affect the development of this dermatological condition. Following these conditions makes the diet an ideal complement to the acne treatment process. The diet of teenagers suffering from acne. Fatty acids. Fats are macronutrients that are essential for our survival. Vitamin F, discovered in 1928, particularly affects the condition of human skin. It consists of a complex of polyunsaturated fatty acids, and its name itself comes from the English word fat and includes omega-3 and omega-6 fatty acids. Remedy for teenage acne. Mainly essential polyunsaturated fatty acids, linoleic acid and alpha-linolenic acid. The human body cannot synthesize them, so they must be obtained from food. Seafood such as salmon, mackerel, cod, and fish oil are good sources of dietary icosapentaenoic acid and docosahexaenoic acid, which are usually lacking in Western European diets that include a significant amount of omega-6 fatty acid-containing products. Sources of alpha-linolenic acid can be flax seeds, chia seeds, nuts, and vegetable oils such as olive or flaxseed oil. Scientific research shows that fatty acids have a positive effect on the condition of the skin, reducing inflammation and allergic conditions, suppressing the immune response, as well as reducing the severity of inflammatory and bacterial processes. Moreover, they exhibit photoprotective and anti-inflammatory properties, like vitamin A, improve skin hydration, density, and elasticity. A deficiency of PFAS can cause a decrease in skin sebum fluidity, which is associated with the closure of sebaceous glands, disruption of epidermal keratosis, and the appearance of blackheads. The ratio of omega-3 and omega-6 polyunsaturated fatty acids should be 1:3 to 1:5. An imbalance towards an increase in omega-6 acid intake can contribute to the intensification of pro-inflammatory factors and, consequently, the development of acne. Studies have shown that typical acne symptoms. Important information states that fish oil can reduce inflammation by suppressing the secretion of cytokines responsible for inflammation, as well as leukotrienes and prostaglandins. The ratio of omega-3 to omega-6 fatty acids in traditional diets of residents of islands such as Java, Japan, and others where acne is almost non-existent is 1 to 1.6, 1 to 2, in contrast to 1:20 in Western diets. Do you feel the difference? The Western diet increases the availability of free palmitic and oleic acid in sebaceous glands, thereby stimulating comedogenesis and inflammation mediated by interleukins 1 beta and 1 alpha. Oleic acid is an important nutrient for Propionibacterium acnes. Excessive secretion of sebum, including a large amount of palmitic acid, lipotoxically affects the pilosebaceous unit, leading to local inflammation. Omega-3 fatty acids have a positive effect on skin condition by thinning the sebum, reducing inflammation, and increasing the skin's resistance to allergic and bacterial factors. High glycemic index foods are one of the main factors in the Western diet that exacerbate acne. This is a measure indicating an increase in blood sugar levels after consuming 50 grams of carbohydrates from a specific food compared to the blood sugar level after consuming 50 grams of pure glucose. Other researchers have concluded that chocolate can worsen acne. They examined a group of people who did not take any medications or supplements for 1 week. Every day, the participants consumed about 340 grams of chocolate. After a week, these people had a significant increase in the amount of acne. It can be assumed that due to the presence of caffeine, serotonin, phenylethylamine, which increase insulin levels, acne exacerbation occurs. Chocolate and cocoa and sweets are combined with a large amount of added sugar, which determines a high glycemic index. Therefore, be careful with chocolate. But at the same time, avoiding spicy foods and chocolate should only be applied to people with a clear exacerbation of rashes. That is, everything in moderation and without fanaticism. After taking vitamin D, clinical improvement was observed in 50% of acne patients with vitamin D deficiency. Vitamin D is responsible for the proper functioning of over 200 genes. Correction of its deficiency contributes to the weakening of mTORC1 signaling and an increase in cathelicidin, a peptide with bactericidal activity against Propionibacterium acnes. Thus, dietary intervention is a good opportunity to reduce the intensity of mTORC1 signaling. It should consist of adequate intake of complete protein, reduction in the consumption of high glycemic index carbohydrate-rich foods, and an increase in the intake of antioxidants. Polyphenols, such as resveratrol, catechins, and chlorogenic acid, found in wine, tea, and coffee, also inhibit mTORC1 activity and reduce acne symptoms. Resveratrol, a flavonoid found in grapes and red wine, is considered a promising substance in acne therapy. Studies have shown that it has a strong bactericidal effect against Propionibacterium incis. 7 tips from the Healthy Child University for a teenager with acne. 1. Follow a low glycemic index diet. 2. Avoid chocolate, sweets, fried and spicy foods. 3. Limit the consumption of products containing saturated and trans fats. 4. Drastically limit or exclude milk, especially skim milk. 5. Increase the amount of vegetables and fruits in your daily diet. 6. Take additional zinc, selenium, vitamin D, resveratrol, omega-3 fatty acids, calcium, if you have excluded milk, vitamins A and E. However, before taking these dietary supplements, consult a dietitian who will advise you on what to use, in what quantity, and for how long. 7. Take probiotics containing lacto and bifidobacteria for a sufficient period of time. Such an individual and comprehensive approach, as well as cooperation between doctors and dietitians, can provide the best results for achieving maximum effect in treating acne, and your teenager will look great. May your children be healthy and successful.